There is so much more you can do besides just taking the pill or going on some diabetes medication to wrangle this and get it under control and get your life back. Hi, I'm Dr. Angela McKay, chiropractor and naturopathic physician, and we're talking about PCOS or polycystic ovarian syndrome this week. So let's talk about what the motivation is to do something about it. So PCOS, a lot of times when young women start to have their period for the first time in their early teens, it's very often not regular, and that's considered normal for people who are just establishing their cycles. So the first year or two really having irregular cycles, it may be PCOS or it just may be the normal fluctuation of hormones and getting your cycle established. If that period comes on in your early teens and instantaneously you're having all these symptoms of really heavy cramping, heavy flow, I've had patients who are like throwing up, it's so severe, and having to literally crawl to the bathroom because of the cramping and the pain and the nausea. If it's severe like that, that needs to be fully worked up. Along with that, the acne is a common thing for teens, but if it's especially along the jawline and especially if there is hair growth associated with it, you want to check that out a little bit more in depth. Some women are a normal weight and they don't have a problem with weight gain, but weight gain is very typical. So sometimes that weight can come on overnight. So you're going along just fine, and then something happens. Maybe you've achieved pregnancy and that stimulated a significant weight gain. Maybe you're going through some sort of stressor and that stimulated a significant weight gain, but the weight just sort of appeared really kind of quickly. And then despite your best efforts is not budging when you change your diet and you start exercising and you do all the things you're supposed to do, it doesn't come off. That can be a trigger that it is PCOS. So the big motivation to take care of this, for some women, it could be the cosmetic things, but this really is a fully systemic disease that you want to stay on top of so that you can live healthfully and live your best life. And there is so much more you can do besides just taking the pill or going on some diabetes medication to wrangle this and get it under control and get your life back.